What if I told you that one food sitting quietly in your kitchen right now, something most people over 65 eat without a second thought, could be slowly irritating your nerves day after day? I know that sounds too simple, and you're probably thinking, I've heard this before. Every week there's a new food to fear. You may have already tried supplements, special vitamins for nerves, low-sugar diets, cutting carbs, walking every day, listening to advice from friends, TV doctors, or the internet, only to feel the same tingling, numbness, burning, or weakness creeping in anyway. My name is Dr. Emily Carter, and I've been treating men and women in their 60s and 70s for over 24 years. And what I'm about to explain to you is not trendy, not extreme, and not about giving up everything you enjoy. But when done correctly, it can lead to up to a 30–40% improvement in nerve symptoms in many of my patients, sometimes in just weeks. I see patients every single week who are doing everything right. They take their medications, they watch their blood sugar, they walk after meals, they spend money on supplements, they track numbers. And yet, the burning feet at night, the numb fingers, the pins and needles feeling, those symptoms refuse to leave. And I see the exhaustion in their eyes, the frustration, the fear that this is just how it's going to be now, the money spent, the constant vigilance, the quiet worry from spouses who notice them stumbling more, sleeping less, and rubbing their hands or feet in the dark. Before we go any further, let me ask you something simple. Please take a moment and comment below with your country or city. I read those comments personally, and it helps me understand where you're watching from. And let me be absolutely clear from the start. This is not about replacing your medication. This is about safely supporting your nervous system alongside the care you're already receiving. Now let's talk about what's really happening inside your body after 60. As we age, several changes occur that directly affect nerve health. First, blood flow to small nerves decreases. Those tiny blood vessels that feed your hands and feet don't deliver oxygen and nutrients as efficiently as they once did. Second, insulin sensitivity declines, even in people without diabetes. This means blood sugar spikes higher and stays elevated longer after meals, quietly irritating nerve tissue. Third, vitamin absorption drops, especially B vitamins that nerves depend on. You can eat the right foods and still not absorb what you need. And fourth, chronic low-grade inflammation increases. Not the kind you feel like pain, but the kind that slowly damages delicate nerve fibers over time. But here's what most people, including many healthcare providers, completely miss. It's not just what you eat, it's how often, how fast, and in what state your body is in when you eat it. Even mild symptoms, slight tingling, occasional numbness, nighttime burning, create measurable damage over time when the trigger keeps repeating. Let me tell you about Margaret. Margaret is 72. She looked at me one afternoon and said, "Dr. Carter, I don't understand what I'm doing wrong." She was taking her medications perfectly, eating healthy, walking 30 minutes a day, tracking her glucose, taking a nerve supplement her daughter bought her. Her husband was worried because she had started waking up at night with burning feet and dropping things during the day, so I asked her one simple question about her routine. "What do you usually eat in the morning?" She smiled and said, "Just toast. Plain toast. It's harmless." That's when the puzzle came together. The food I'm talking about today, the one that looks harmless, is refined white bread and similar ultra-processed starches. After 65, your body processes these foods very differently. When eaten alone, especially in the morning or late evening, they cause rapid blood sugar spikes, followed by sharp drops. That roller coaster stresses nerves, increases inflammation, and reduces blood flow to nerve endings. Margaret's aha moment came when she realized she was eating toast on an empty stomach, dehydrated every single morning. We made 3 small changes, exact changes, strategic changes. She drank 12 ounces of room temperature water first thing in the morning. She delayed bread for at least 30 minutes, and when she did eat it, she paired it with protein and healthy fat. 2 weeks later, she called my office. Her voice sounded lighter. After 1 month, her nighttime burning had decreased by 35%, and her grip strength improved measurably. She laughed and said, "I honestly thought you were a little crazy, doctor." But it worked. Before I teach you the full method, let me explain the 3 most common mistakes I see every single week. Mistake number 1. Eating refined starches alone. That's like lighting a match under dry paper. The fire flares instantly. Mistake number 2. Eating them while dehydrated. It's like watering a plant with dust-dry soil. The water runs right through without nourishing the roots. Mistake number 3. Eating them late at night, when nerve repair should be happening. Science shows nighttime glucose spikes interfere with nerve regeneration hormones. Now let me introduce you to the CALM method. C stands for combine. Never eat refined carbs alone. Always combine with protein or fat. A stands for adjust timing. Eat them midday, not early morning or late evening. L stands for liquid first. Hydration before food reduces glucose spikes by up to 25%. M stands for mind the portion. 1 slice, not 2 or 3. The method has 3 phases. Phase 1, preparation drink 10-12 ounces of water. Room temperature, wait 10 minutes. Phase 2, consumption. If eating bread, keep it to 1 slice. Pair with eggs, yogurt, nut butter, or avocado. Eat slowly, at least 10 minutes. Phase 3, movement. A gentle 5 to 10 minute walk within 30 minutes improves glucose clearance and nerve blood flow. This works because it stabilizes blood sugar, improves circulation, and reduces inflammatory stress on nerves. Let me tell you about Robert, 76. His biggest complaint was numbness and fatigue. His A1C was borderline. He started with just 1 change, no bread alone. 3 weeks later, he said he felt genuinely different. 2 months later, his labs improved enough that his doctor adjusted his medication slightly. Now, practically speaking, people ask me, how much? 1 slice. How often? Not daily, 2-3 times per week. Bottle tip, keep water by your bed. Reminder, phone alarm labeled drink first. Week 1, fewer spikes. Week 2, better sleep. Weeks 3 to 4, noticeable symptom relief, long-term stabilization. Patients often tell me, Doctor, I just feel better overall. Let me be absolutely clear about something critical. This is not a replacement for medical care. Do not stop medications. Do not ignore your doctor's advice. If you have diabetes, kidney disease, or severe neuropathy, consult your physician before making changes. Finally, I want to tell you about Helen. Helen suffered for nearly 18 years, tingling, fear, hopelessness. She believed damage was inevitable. She followed the CALM method consistently. One day she cried in my office and said, I wish someone had told me this years ago. I want to challenge you personally. Try this for 14 days. Drink first, combine wisely, adjust timing, track symptoms. Comment your progress below. If you made it to the end, type CALM in the comments. Share this with someone you love. Subscribe and turn on notifications. Small strategic changes done consistently create genuinely measurable results over time. This is Dr. Emily Carter, and I'll see you in the next video.